Purina's answer to Gronwin. It's the same kind of thing. It's about a 30 to 35% protein pellet with trace vitamins and minerals in it. As fed, according to I would recommend feeding it about half to 2 thirds of label recommendations, but it's
So don't feed as much as they say.
probably not.
As they say, you buy it more often.
Oh. It's, getting your feeding advice from someone who sells feed for a living always has to be considered somewhat of a biased recommendation. Not always. There are some companies that actually do a really good job, but they're always trying to sell a product. So it's never going to be considered unbiased information. So, but as far as those products go, either Enrich 32 or Gronwin, they don't have an awful lot of non-structural carbohydrate in them. They tend to be safer ways to get protein and trace minerals into, say, horses that are insulin resistant and are prone to laminitis than giving them your average complete feed. So we use it in the hospital quite a bit, actually. Any questions?
With respect to the red cell, isn't there a limit in how much the body can absorb?
Yep, you bet. It's a very saturable process at a lot of levels, and so it's just not likely to be limiting equine diets.
Okay, so the dosage that they're even recommending there may not even be absorbed.
It's all true. A lot of it isn't. And when we see complications of iron overload, and in adult horses or in equine medicine, it's usually in horses that have received transfusions. It's interesting that the first pass of everything that's absorbed from the GI tract is the liver, which is where we tend to see problems with iron loading. And so, again, there's not a lot of evidence to suggest that giving red cells is going to hurt your horse's liver unless they happen to be a very young foal, in which case it might. I don't know if that answered your question or not. Probably not. Anything else? Did I miss any supplements that anyone gives that want to address?
Can you talk a little bit about probiotics?
Yes. Actually, that's the first thing I went into TSC looking for. Okay, when we talk about probiotics, yes. So probiotics, I'm sure everyone has seen the tubes of Lactobac or Equibios gel that contain usually certain cultures of Lactobacillus species bacteria. And people give those in the cases of diseases in which we assume that there's some disruption of the horse's colon flora. And we make a lot of assumptions giving those things. We assume that, A, if I buy this tube of paste and I keep it in the top drawer of my vet truck for 9 months, that on those 90-degree summer days I haven't completely nuked whatever is sitting in that tube. Assumption number 1. Assumption 2 is if I give this orally to an adult horse, is it going to make it past the gastric acid barrier through the small intestine all the way down to the large colon where I suspect that the problem is? That's another assumption that we don't know if that happens or not in horses. And 3, again, in the vein of first do no harm, there are some studies to suggest that those are not good products to give to foals. And so neonatal foals, i.e. anything less than 30 days of age, in my professional opinion, shouldn't receive a probiotic. So other ways that you can give animals probiotics that might not involve you buying a very expensive supplement would be to use yogurt with live active cultures. For the most part, many of them are the same thing.
Frozen activity blocks.
Oh, I love them. Again, I'm not, it's probably, unless it's a foal, in which case it could potentially hurt something. If you're giving it to an adult horse, it's probably not going to hurt anything. We have several horses in our practice that receive yogurt as a carrier for oral medications, and they love it. It's a big question. Probiotics are a controversial subject, and technically the best probiotic for an adult horse would be poop from its normal neighbor, given via nasogastric tube, or even better, given right into its colon. So people find that disgusting, but ideally that's the ideal probiotic would be.
Okay.
Foal's got it right, I
Interesting.
guess.
Yeah.
Yeah. Everyone's been approached by the foal with a little poop list. It's very cute. Okay, there in those bags. Yes.
Is there a magnesium deficiency in soils in Ohio? I hear a lot of supplementation using magnesium oxide.
That's very hit or miss. A lot of times when people are recommending these days to to supplement with magnesium, it's not necessarily because they're deficient, although, again, we can assume that most forages in our area are selenium deficient. With magnesium, it's very patchy. It's very patchy, so if you really wanted to know, it's probably best to have your forage analyzed. But people will supplement with magnesium because there used to, well, not used to be, there still is, but back in the early to mid-90s to early 2000s, there's a lot of data in the human literature to suggest that magnesium supplementation improved insulin sensitivity. And so a lot of people would supplement with magnesium and chromium to try and improve insulin sensitivity in their horses. It's probably not quite that simple, but magnesium, if it's a horse with normal kidneys, you're probably not going to hurt anything by giving it enterally. Incidentally, though, if you can give enough magnesium sulfate to a horse to anesthetize them. Usually you're giving that IV, but it is possible to give enough magnesium enterally to cause a problem. It's usually in the pound range, so it's probably not something you're sprinkling on top of the feed. It's not, in and of itself, it's not entirely innocuous. I'm not sure where people are getting their hands on them, but we find there's people at horse shows that are walking around with little vials of mag sulfate, and they'll give them right before horses go in a ring as a quieting agent. And like I said, you can anesthetize a horse if you give them enough mag sulfate IV. Scary stuff.
Stuff they give you when you're pregnant, isn't it? That stuff's terrible. Oh. I feel like they have the